Hello to all viewers. Welcome to my channel. If you're new here, I'm Dr. Shivika Sethi, a national level faculty of microbiology. I'm also the author of the review book of microbiology, that is Mastering Microbiology for all PG entrants and academics. So today I'm going to be discussing the important steps which are taken to prevent transmission of infections among the patients, amongst the healthcare workers and the visitors to the hospitals. So basically, we are going to study hospital infection control. So for this purpose, in hospitals, we use two types of precautions. One are the standard precautions, which are going to be followed at all times, and the other are the transmission-based precautions. So today I'm going to be stressing more on transmission-based precautions, just giving an overview of the standard precautions. Okay. For standard, I will record another video where I'll be going into the details of where we are using the various standard precautions. Okay, or rather how we are using the standard precautions. Then here I'm going to be discussing more about transmission-based precautions, which are contact, droplet, and airborne transmissions. Okay, for which organisms, which infections are we going to follow them? At the end of this session, I'm going to be making a nice table where we are going to compare the important steps taken in the various types of transmission-based precautions. And right at the end, we will be taking up a few MCQs that we can extract from this topic. Okay. So standard precautions are those steps that are taken at all times, in all situations, for all patients, whatever be their infection status in the hospitals. Okay. So first, and the cornerstone of the standard precautions is hand hygiene. Okay. Second is the proper wearing of the personal protective equipment. Okay, so according to the expected exposure while handling the patient, whatever is expected, we are going to wear the gloves, the masks, the gowns, and the goggles, the face shields, and so on. Next is respiratory hygiene. That is, you should always cough in tissues, or if you don't have a tissue, cough into the elbow. Don't cough into your hands. Do hand hygiene after coughing and so on. Next is cleaning and disinfection of all environmental surfaces as well as patient care equipment. So at regular intervals, these should be cleaned as well as disinfected. Next are safe injection practices. Right? Like you prefer to use single dose vials in comparison to multiple dose vials and so on. And in recent times, the Center of Disease Control has added another point in safe injection practices is that use surgical mask while carrying out lumbar puncture. It should be a routine. Okay. Next is proper handling as well as disposal of the needles and the sharps. Okay, they should be properly disposed of. Next are the decontamination of the patient care linen, right? And handling. No, don't make too much of movements while handling the patient linen, changing their clothes, changing their bed linen. And lastly, the bio-waste management. Okay, so those are the 8 important standard precautions that should be followed for all patients, for all situations in any kind of, whatever be the infection status of the patient. Okay. Next, we move on to what are transmission-based precautions. Okay, so these are added in addition to the use of the standard precautions. When standard precautions are insufficient to prevent the transmission of infection, then we're going to take these additional steps. So these are primarily determined. What kind of precautions are to be taken determined by the mode of transmission of these pathogens. So we can use one or more transmission-based precautions according to their mode of transmission. Droplet with contact, aerosols with contact, or simply contact precautions, right? And whatever is the decision to be that is taken, that signage has to be put outside the patient's room, okay? Because everybody must be on guard before entering the patient's room, right? So this is contact precaution room, this is droplet precaution room, and so on, right? So signages like this should be put outside the patient's room. Contact precautions, airborne precautions, as well as, right, contact plus airborne precautions to be taken. Okay, so let's take them up one by one. First are the contact precautions. Okay, so these are to be taken for patients who are infected with pathogens that are transmitted directly by patient contact or indirectly via contaminated equipment or surfaces, right? So direct or indirect contact with the patient or his equipment or surfaces. So what are the important contact precautions? The first one is, once you've identified your patient, you should see what kind of patient placement should be done. So preferably this patient should be put in a single room, right? If possible, single occupancy room. If a single occupancy room is not possible, then what are we going to do? We're going to group them, cohort them with patients who are infected with the same pathogen. Okay. If even this cohorting is not possible, in that case, we can put them with other patients, but we are going to avoid placing these patients with immunodeficient patients or patients with open wounds or have anticipated long stay in hospitals. Okay, so you can put them with any kind of patient except for these patients, right? Immunodeficient, open wounds, or anticipated long stays. Then in case you have put them in with more patients, then in that case you're going to do a spatial separation of at least 3 meters and put privacy curtains between their beds, and change your personal protective equipment and perform hand hygiene between contact with the patients in the same room. Okay, so if you've examined one patient, before you go to the other patient, you have to change the personal protective equipment, like change your gloves, change your gowns, right? And dispose them and wear fresh ones, and then examine the other patient in the same room. Okay, now next is, in such patients, what we have to do is all notes, right? Whatever patient notes that you're making, all charts of the patient, the pulse and so on, all those recording charts should be put outside the patient's room, not in the patient's room. Okay. And once you've walked out of the room, you're going to disinfect the hands and even disinfect the hand after writing the chart of the patient, right? So hand hygiene to be done the moment you walk out of the patient's room. Okay, so that is patient placement. Second step that you're going to take is wear gloves and gowns on entering the room. These may be unsterile ones, okay, but gloves and gowns have to be worn on entering the room. So other personal protective equipment like masks, goggles, face shields have to be worn only if you know you have predicted that splashes or sprays of blood or body fluids may occur into your face or eyes. Okay, in that case, you're going to wear these additional personal protective equipment. What is mandatory is the wearing of gloves and gowns. Okay, then remove and discard these personal protective equipment on leaving the room and do hand hygiene. Okay. Third contact precaution. Use dedicated patient care equipment, or if possible, single-use disposable equipment have to be used on these patients. Okay. If this is not possible, you don't have single-use disposable equipment, clean those equipment, dry them, clean them adequately, and dry them before use on another patient. So these patient care equipment, just couple of examples, like IV stands should be dedicated. They should be within the patient's room. Don't take them to other rooms. Thermometers should be dedicated. BP apparatus cuffs should be dedicated. Bedpans should remain inside the room. Okay. So these should not be shared with other patients, right? And lastly, Limit the transport of such patients outside the room. Okay, the room, don't ask the patient not to move out without asking you. In fact, they should be totally restricted movement. They should be taken only if it is medically necessary to take out these patients. Like, and once you have to take them out for, say, for any special surgery or some special like diagnostic procedure, in that case, cover the infected or the colonized area. Remove, and what you have to do yourself is, before taking this patient for this, remove the personal protective equipment you were wearing earlier, dispose it off, and perform hand hygiene and don fresh personal protective equipment on yourself before transporting this patient. Okay, right? So limit transport and the movement of the patients outside the room, but do it if it is medically necessary, right? So let's find out which are the infections or the pathogens for which we are going to follow contact precautions. So one is multi-drug resistant organisms like vancomycin-resistant enterococci, methicillin-resistant staph aureus, or vanco-resistant staph aureus, or carbapenemase-producing resistant, carbapenem-resistant enterobacteriaceae. So all these multi-drug resistant organisms. Next is skin infections like impetigo, herpes simplex, leprosy, scabies, cutaneous diphtheria, pediculosis. So skin infections, obviously we're going to take contact precautions for them. Then wound infections, draining abscesses, the patient has burns. Then conjunctivitis patients, gastrointestinal infections like Clostridium difficile, rotavirus. Then diapered patients or incontinent patients like any other diarrheal disease in which the patient is either diapered or incontinent. Then hepatitis A and hepatitis E patients who are either diapered or incontinent. Okay, so for all these, we're going to follow contact precautions. This is a small list. We are going to add this to this contact precautions when we move on to droplet and airborne transmission precautions too. Right. So that's our contact precautions. Let's move on to droplet precautions. So these are to be followed for patients who are infected or suspected to be infected with pathogens which are transmitted by respiratory droplets, that is, which are more than 5 microns in size, which can be generated either by during coughing or sneezing or while talking. Okay, so that's the size, big size. So they are going to settle down the moment they are created, just they fall of some distance down, apart, forward. Okay, so what are the precautions for these patients? First of all, let's see their patient placement. Again, we're going to put them in a single room, preferably. If it is not possible to put them in a single room, then again, we're going to do the same, cohort the patients infected with the same pathogen. If this is also not possible, cohorting not possible, then you can place them with other patients, but avoid placing them with immunodeficient or patients who have anticipated long stay. Okay. Then if you have put them with other patients, do a spatial separation of more than or equal to 3 meters and put privacy curtains between the beds. Again, we're going to do the same thing, change personal protective equipment and perform hand hygiene between contact with the patients who are in the same room. Okay, so that's our patient placement. Next, what is the most important personal protective equipment? Because they are transmitted by respiratory droplets, we are going to don a mask on entry into the room space. Okay, like in contact precautions, what was important? Gloves and gown was important. Here, wearing a mask is most important. And dispose of this mask after exiting the room. Obviously, if you're expecting other kinds of exposure, like splashes, etc., or spills, then you're going to wear other personal protective equipment also. But this is mandatory mask. Then moment you walk out of the room, hand hygiene is to follow. If there is, as I said, if there is any risk of splashes or spills, then wear appropriate personal protective equipment. So that's our PP story. Next, limit the patient's movement outside the room, but if it is mandatory to take out the patient for some diagnostic procedure, then what are we going to do? We are going to make the patient wear a mask and ask him to follow respiratory hygiene or cough etiquette. Okay, so donning a mask of the patient here also becomes important. Okay. So droplet precautions are followed by for which of the following? So you can use this mnemonic, as you can see, the Spider-Man, the word Spider-Man, to remember the organisms or infections for which we're going to follow them. So S standing for strep pharyngitis and scarlet fever, P standing for pertussis and pneumonic plague, I for influenza, D for diphtheria, E for Ebola and epiglottitis, R for rubella and respiratory syncytial virus, N for mumps, mycoplasma pneumoniae infection, or and Marburg virus, then respiratory tract infections due to adenoviruses and Neisseria meningitidis, whether it is simply meningitis or meningococcemia. Meningococcal infections are also to be given droplet precautions, right? So Spider-Man is that mnemonic by which you can remember this. Then for the following four organisms that we've already written, we are also going to add contact precautions for influenza, respiratory syncytial virus, Ebola and Marburg virus. Okay. Now, Ebola and Marburg, please also remember, along with that, generally when we talk about Ebola and Marburg, we also talk about Lassa fever, right? So because all these three cause hemorrhagic fevers, so add Lassa fever along with Ebola and Marburg, right? So for these droplet precautions, 4 plus contact precautions are to be followed. Next, we move on to airborne precautions. So these are to be followed for patients who are infected with pathogens which are transmitted by very, very small droplet nuclei. Okay, so aerosols which are very tiny, less than 5 microns inside, less than or equal to, which remain suspended in our environment for a long time, right? So for them, we are going to take airborne precautions. So what are the steps? Firstly, we're going to isolate this patient in a special room, which is called as a negative pressure room, or now called as airborne infection isolation room. Okay, so these have self-closing doors, right? So and plus there is restricted entry of visitors, and especially susceptible healthcare workers are not allowed inside these rooms. So these rooms are maintained under negative pressure, by which we mean that air can flow just beneath whatever space there is between the beneath the door. So air cannot just go through that outside. In fact, air is pulled inside from the corridors. Okay, so that is called as maintenance of negative pressure rooms. And apart from this isolation of the patient, we are going to have the we are going to wear N95 respirator masks, okay, just before the entry. These are to be worn at all times, and remove and discard the respirator just after exiting the room. Okay, and instead of this respirator, we can also use a powered air purifying respirator. And if you're expecting splashes or spills following the entry into the room, then obviously we're going to wear other personal protective equipment also, and wear it accordingly. Next, avoid necessary transport or movement outside the room. If medically necessary, ask the patient to don a mask and follow respiratory hygiene and cough etiquettes, right? So that's our airborne precautions. For which organisms are we going to follow these airborne precautions? measles, tuberculosis patients, then chicken pox, disseminated zoster, variola, vaccinia, SARS, and avian influenza. Okay, so variola now, of course, it is no longer reported, that is smallpox. So we can still afford to forget about variola. Even vaccinia is very, very rare disease, but we must remember these 6 pathogens: measles, TB, chickenpox, disseminated herpes zoster, SARS, as well as avian influenza. Okay. Now, for measles and TB, it is just airborne precautions, but for chickenpox, disseminated zoster, we will add contact precautions. And for SARS and avian influenza, we are also going to add eye protection along with the contact precautions. Okay, so I've made a mnemonic to remember the airborne precautions, disinfections. Mr. instead of Mr., right? Meester. Meester, that will tell us measles. Mr. tuberculosis, disseminated variola, SARS, and avian influenza vaccine to the chickens. Okay, so by that you can remember these important pathogens. That does with our 3 types of precautions. We move on to comparing them. Okay, so standard precautions. We don't need an isolation room at all. Hand hygiene is to be followed always. Gloves, when are we going to wear them? When we are going to likely to touch blood, body fluids, and contaminated patient's item. Apron and gown to be worn if soiling is likely. Mask is to be donned during procedure likely to generate contamination with blood and body fluids. And eye protection or face shields we will add during procedure which are likely to generate contamination with blood and body fluids. Now let's come to contact precautions. For them, we require a single room. We have already talked about it, and minimize the time outside. Okay. Hand hygiene has to be followed. And what are we going to wear? Wear gloves while entering the room and discard them on exit. Apron and gowns are necessary again on entering the room, discard on exit. Masks and eye protection and face shields we are going to wear only when we are anticipating contamination with blood and body fluids. Moving on to droplet precautions. Again, a single room is required, preferably. Minimize the time outside. Follow hand hygiene. Gloves are to be worn when we are likely to touch blood, body fluids, and contaminated items. Apron and gown to be worn if soiling is likely. So this is just like standard precautions. Mask is mandatory before entering the room. Discard this mask on exit from the room. Eye protection and face shields are to be worn if we anticipate we're going to generate contamination with blood and body fluids. Lastly, airborne precautions. Again, a single room which is special. Negative pressure ventilation is there. Okay, and minimize the time outside. Right, and in case the patient has to be taken outside, then the patient will be asked to wear a mask. Hand hygiene, yes. Gloves to be worn when likely to touch blood, body fluids, and contaminated items. Apron and gown to be worn when soiling is likely. What is the mask we are going to don? A special filtration, high efficiency filtration mask like N95, which is to be worn on entering the room and discarded on exit from the room. Lastly, eye protection and face shield to be worn during procedure likely to generate contamination with blood and body fluids. Okay, so hopefully this will clear all your doubts on standard, contact, droplet, and airborne precautions. Now let's take up a few MCQs and learn how we can be asked the questions. A patient with disseminated herpes zoster requires routine tracheostomy suction. Select the appropriate personal protective equipment you will wear. So first of all, what are we going to remember? That for herpes zoster, we require airborne precautions. We also require contact precautions. Okay. So plus, because we are expecting sprays, because it's a tracheostomy suction, so we're going to wear personal protective equipment like a face shield or a goggles, right? So N95 mask will be worn, contact precautions, gown and gloves will be worn, and along with that, face shield will be required because we are going to do a tracheostomy suction. Okay. You are providing a lecture on transmission-based precautions to a group of nursing students. Which statement made by a student warrants re-education on the topic? That means which statement is wrong. First, I will make sure that any patient in droplet precautions wears a surgical mask when being transported. Yes, for both droplet and airborne transmission precautions, the patient is asked to wear a surgical mask. Second, patients with airborne disease like meningitis require a special room maintained under negative pressure. Meningitis is not an airborne disease. Okay, so they do not need to be maintained under negative pressure. This is a wrong statement. So this warrants re-education of the student. C option, I will always wear a gown and a mask when entering a room of a patient in contact precautions. Absolutely correct. Gown and masks are necessary. If I provide care to a patient with Clostridium difficile infection, I will always wash my hands with soap and water, not with a hand sanitizer. This we will study when we do standard precautions, that for Clostridium difficile infections or rotavirus diarrhea patients, instead of using hand sanitizer anytime you touch such patients or their surroundings, you are expected to wash your hands, not disinfect them with alcohol-based hand rubs, right? So in this question, our answer is option B. Select all the conditions that warrant airborne precautions. Norovirus, hepatitis A, what if the patient is incontinent for hepatitis A, then what do we use? Contact precautions. For varicella, that is chickenpox, for measles, for disseminated herpes zoster, and for tuberculosis. What are we using? We are using airborne precautions. Okay, so for varicella, measles, disseminated herpes zoster, and tuberculosis. Okay, for whooping cough, no. For RSV, no. Right. So this brings us to the end of our session. Join me in my next video, which will be details of standard precautions.